Hey guys, welcome back to Urology 101. So today's going to be a little different. Instead of talking about a specific diagnosis or something, I really want to go over a couple terms and what in the world we mean sometimes when we're talking. Because today I was talking with a patient, and after going back and forth on some things for about 5 or 10 minutes, he stopped me. He said, "You know, you've mentioned this and you've said something differently 3 or 4 times, and I don't really know why you're saying it differently each way, but isn't there just one term? Can you just use one thing for me?" And he caught me on it, and I recognized that and thought, damn, I I've done something that I never want to do, which is I'm not being direct, I'm not defining stuff, and I had to stop for a second. Like, you're right, I'm sorry. Let's work on this. And so I want to go through some of the conversation I was having with that patient, and also just really help define that, because I think we in medicine do that all the time, and I've mentioned that before, where we have like 3 or 4 terms or 5 terms for the same stupid thing, and that has to be so frustrating from a patient standpoint. And I can remember when I was in med school, I was talking with my dad, who is also a physician, and got so frustrated because I couldn't understand why something would be called arteriography and an arteriogram, or why someone would use the word cephalad and superior and rostral when they all mean the same thing. It would drive me nuts, because it's not like there's some big doctor dictionary of terms that says, oh, these are all synonyms, so when we mean that, we say this, we just mean that thing too. And it also brings me back to remembering a bit in Seinfeld, for all you Seinfeld fans, where Costanza is talking about needing a biopsy on something on his lip, and he says to the doctor, like, hey, is this cancer? And the doctor sort of hems and haws. He goes, well, I don't know. And Costanza's complaining to Seinfeld, like, hey, that should be part of medical training. What is this, cancer? What are you, crazy? Get out of here. And you know what? He's probably onto something. That really probably should be. So let's spend some minutes on all of the terms that we use sometimes to talk with our patients in a way that is supposed to be empathetic and paternal, in the sense that we want to get the point across that we're concerned about something, but we get lost in the words and don't always communicate effectively to you. So let me try and do a little bit of that with you. Excuse me. And so one of the words we'll tend to use is lesion. Lesion really is not a specific term. It's a wastebasket umbrella term, so anything can be a lesion. The next thing that we'll use sometimes is mass. And mass gets closer to talking about cancer, except not all masses are cancer, and not all cancers are masses. So we may use the word mass because we want to get a point across that we're concerned about something, and we may need to get some tissue, or we may need to do some extra tests. But it doesn't mean cancer, because there are lots of masses that are not cancerous. Sometimes people use the word neoplasm, which is really dirty and probably mean to patients, because that's a term that is not a colloquial term. It's not used in everybody's daily lexicon. So the idea to say, oh, you may have a neoplasm there, that's just completely unfair. So neoplasm is Latin for new growth. Neo meaning new, plasm meaning growth. So new growth. And that again just means that something is growing. It does not mean that it's a cancerous growth. It just means that something is growing. And then somebody may say, oh, well, we think it's a benign neoplasm. Okay, so cancers are neoplasms and go through what is called neoplasia, which is just the concept of the growth. So if we look at, let's just stick with neoplasia right now, and we'll work our way back to mass and lesion and cyst. So if we look at neoplasms, some of them are what's called benign. Those are growths that are not necessarily regulated. It's growth that's happening, but it's not cancer in the sense that it doesn't leave that organ, it doesn't leave that tissue and spread around. Then there are neoplasms that are malignant, all right? And those are what we call cancer. And what that means is that their cells, all cancers in some way, are just unchecked, unregulated growth. So these cells from an organ or a tissue type just start growing. And they don't go through the normal checkpoints, they don't go through the normal stop mechanisms, they just keep growing. They've lost that ability to stop growing. And cancers all have that in common. And then some of them will end up, some of those cells will leave that initial organ and travel elsewhere. And maybe they'll travel to the lymph nodes first. Those are drainage sites for organs. Fluid drains out, goes to what are called lymph nodes, through what are called lymphatics. And sometimes that's the way that things drain. And sometimes things also drain through the blood, and they can drain through bone. So those are methods of travel for cancerous cells from organs out. And when cancer cells or cancers move from one organ to some other site, that's called metastasis. And so the concept that I try and talk with patients is this idea of everybody's yard and weeds and dandelions. And you think, okay, well, let's talk about it in this term. If you have a dandelion and you go pick that dandelion and you get it at the root and the weed and you get rid of it, you don't have any spread of dandelions in your yard. So that would be a cancer that's in an organ that's confined, that's stuck in that organ, and it probably hasn't left the organ yet. And if you don't get that dandelion, either because you don't get it in time or you didn't see it or any of those things, and it has the chance to spread, well, that dandelion has now metastasized throughout the yard, and it's everywhere. And it doesn't necessarily destroy all of the grass in your yard, but the yard doesn't look good anymore. And so many of the nutrients in that yard are no longer going to the regular grass that looks normal and healthy, they're going to the dandelions. And that is essentially what happens when people have cancer that metastasizes outside of that initial organ and it's not caught in time to be what we call organ confined. Now that doesn't necessarily fit with some types of cancer, but most types of cancer fit inside of that concept. So when we say that something's a neoplasm, a lot of neoplasms are benign and not malignant. So malignant neoplasms are cancer. Benign neoplasms are just ones that sort of, they don't invade other organs, they just sort of push, but they stay in the same organ. So they're not spreaders, they don't invade, they just sort of push on things. And sometimes those are removed because people want to make sure that they're not cancer, and sometimes they're removed because they cause other problems. But benign means that it doesn't have the features to travel to another organ, and oftentimes it doesn't need to be treated and doesn't need to be followed that much. Now let's work our way back. So mass. A mass can be a neoplasm, whether that be benign or malignant, but a lot of times we'll talk to you about wanting to get a biopsy of something. And a biopsy is just collecting tissue to look at it under a microscope so that we can give you knowledge of what it is. Now, lesion, again, is not necessarily a mass. It's just something that looks abnormal. And abnormal doesn't mean bad. It just means different from normal. And so it might be completely okay and not a big deal and something you should never worry about. But we may call it a lesion because it's not sort of a mass-like characteristic and we don't think it's cancer. We just honestly don't always know what things are until we get some tissue. And so as long as you're okay with that, that's really what, at least when I use the term lesion, I don't want to put words in my colleague's mouth, but when I use the term lesion, that tends to be what I mean. And I think a lot of people work that way because we don't want to say to you, well, it could be cancer, so we should do a biopsy. I mean, that seems like quite a jump. So we'll use words that aren't quite as concerning, don't create a level of anxiety, but enough of a push to let you know that we want to look into this a little bit more. And I think that's why we get those words out. But sometimes it comes across as genuinely confusing. Even though it's meant well, it just isn't executed very well. Then sometimes we'll use the word cyst. And a cyst is a fluid-filled structure. So think of just fill up a water balloon and you've got a cyst. Now, some cysts do have areas in them that are hard tissue and that are actually concerning for cancer. So some cancers can be cystic, but there are lots of cysts that are not cancerous. And if it is a simple cyst, meaning just a fluid-filled sac, that is not something that turns into cancer almost ever in any organ system. And when we talk about it in terms of kidneys, which is where we usually see the most cysts for our discipline, a simple cyst, meaning just a fluid-filled sac, that is benign, doesn't need to be followed, will always be a simple cyst. It may get bigger in size, but it's always going to be the same thing. So cysts live on a spectrum, but it's not as though something goes from simple to concerning to cancer. You are either a cancerous cyst going forward or you are a simple cyst, but you are not moving in one direction or the other. There are types of cysts that live in between those two, and we follow those some. But it's not as though a simple cyst can turn into a cancerous one in the same way that primates do not turn into reptiles or something ridiculous like that. So I hope all of these terms make a little bit more sense and just have some general knowledge going forward. I hope that's helpful. Let me know if it isn't or if something still isn't explained very well, and I will try and do a better job. My best to you. Have a good night. Take care of yourselves. Take care of families. See you guys later.